Perkins School for the Blind and Hunter the School of Education present Changing the Way We See, a vision for children with CVI. We're shown 3 photos of children with CVI. Then we transition to a view of Ed Basso.
Good afternoon, and thank you for joining us for what is sure to be an extremely informative session about a brain-based visual impairment called CVI, cortical cerebral visual impairment. I'm Ed Basso, President of Educational Programs and Superintendent at Perkins School for the Blind, and it is my pleasure to welcome you to Changing the Way We See, a vision for children with CVI, a co-hosted event by Perkins School for the Blind and Hunter College. I want to thank Beth Brady, Assistant Professor and Program Coordinator for Blind, Visually Impaired, and Severe Multiple Disabilities from Hunter College for the partnership and the vision necessary to make this event possible. We will be recording this event today, but audience members are muted and videos are off. We will also have closed captioning available. Please click the CC icon at the bottom of your screen to activate subtitles. The incredible thing about CVI is that with an accurate and early diagnosis and access to trained teachers providing our most informed interventions, children with CVI can improve their functional vision. But there are thousands of children with CVI who are not getting what they need. Perkins is leading a cross-sector collaborations across the medical and research community, the educational communities, including higher education, and with parents to address challenges and improve outcomes for children with CVI. In collaboration with Hunter College, we bring this webinar to you with an amazing panel of experts who will help us address the question, what will it take to reach every child with CVI? Again, I thank Beth Brady from Hunter College for the partnership and vision, and I thank all of the Perkins team that helped to make this possible. Our hope is that as you participate, you all can find a way to get involved in this growing movement to ensure that families and children with CVI have access to the services they need to thrive. Before I introduce the panelists, though, you will see a video that exemplifies how collaboration between families, their educators, and the educational team can make a difference.
I'm Lacey. I am Savannah's mom. I had no idea that she had a visual impairment, and I always attributed it to her having hydrocephalus, and her gaze was just a little different. And I think she was 3 months old when we first had an early intervention worker come out and start working with us. At around 6 months old, she noticed that she wasn't really looking at us. We went in to the ophthalmologist and she told us our daughter was blind, and also not having an idea of what it meant for us. Like, we had no idea that her vision would improve. She has a visual diagnosis of cortical cerebral visual impairment.
Hi, I'm Marguerite Tabato, and I'm the Assistant Director of the CVI project here at Perkins School for the Blind. Cortical cerebral visual impairment is a neurological visual impairment caused by injury to the visual processing centers and pathways of the brain. While the child's eyes may be healthy and taking in visual information, their brain is unable to make sense of that visual information. CVI has sometimes been described as similar to looking through a kaleidoscope. While there's a swirling mass of color and light, there's little recognition of what is actually around them.
Savannah always struggled with reaching out for objects. That was with reaching for objects while looking and reaching for objects in general. Now Savannah is a lot more visually aware that she has objects in her environment and she's often reaching out for them.
I've been working with Savannah, her family, and her educational team for the past 2 years. As Assistant Director of the CVI project, my role is to evaluate Savannah's visual skills and support the team in implementing the appropriate accommodations and methodologies. With intervention, Savannah started to look at more items. More recently, Savannah has begun demonstrating visual recognition of familiar items.
So one of the most exciting things that we've seen Savannah do is during mealtime. She's completely motivated by mealtime, and she's gone from, not knowing what a cup or a fork is to being able to choose between the two. In addition to that, she's also now making choices for preferred snack items with the real objects. By her visual skills improving, her communication is also improving for us. which is huge because now she can make contributions to our family mealtime by telling us what she likes, if she likes my cooking, if she doesn't like my cooking, and just being a bigger part of our family.
CVI is the leading cause of visual impairment in pediatrics, and there is a pressing need for early identification, diagnosis, and intervention. These important steps can lead to essential opportunities that support visual improvement. Savannah went from having no visual attention to using her vision to communicate her wants and needs. Savannah is seen and she is heard, and this is something all parents want for their children. Now is the time to ensure that all children with CVI are provided with life-changing accessibility.
Text on screen, Perkins School for the Blind logo.
You can see how early intervention and access to qualified professionals makes a huge difference in the lives of children. I'm now honored to welcome 3 expert panelists who are partnering with Perkins and Hunter. We'll look at the issue through the perspectives of neuroscience, teacher and teacher education, and parents to change the way we see children with CVI. It is truly my honor now to introduce our first expert panelist, Dr. Lakvi Marabet, Director of the Lab for Visual Neuroplasticity at Mass Eye and Ear Institute and Associate Professor of Ophthalmology at Harvard Medical School. Lakvi, welcome.
Thank you, Ed. Excellent. First of all, my thanks to Ed Basso for the kind introduction and invitation to speak this afternoon to all of you. Just to give you a little bit of background on myself, I'm a clinician scientist from the Massachusetts Eye and Ear and Harvard Medical School. And I was asked today to present very briefly or give a quick overview of the research that we're doing on CVI. Basically, our research program can be described in 2 parallel tracks, but at the same time, that are very interrelated and interactive. The first is that we want to develop a better understanding of how the brain develops in a person with CVI. And this is important because we know that CVI is largely a brain-based visual problem, and thus looking only at the health of the eye really cannot explain all the visual difficulties a child is having. Now, there are indeed some more powerful brain imaging techniques out there, like magnetic resonance imaging, that can help us determine whether or not there's been damage to the brain, but it doesn't tell us everything. So what we're doing now is looking at the connectivity of the brain. In other words, understanding how the brain is wired. And we think this will give us a better idea in terms of why brain-based visual impairment, in the case of CVI, is very, very different than eye-based visual impairment. The second area we're interested in is assessing visual abilities in individuals with CVI. So beyond what's done with just a standard eye chart, like reading letters. Now, this is very, very important because the visual world is much more complicated than just a bunch of letters on a screen. What we really want to know is how a child with CVI perceives and interacts the visual world around them, doing simple things like finding their favorite toy in a toy box, for example. So for that, we've been using another approach, and this is virtual reality, to give us a better sense of how to assess visual ability and performance in CVI. So let's take a look at some data here. What I'm showing you here are 3 brains. This is a slice using MRI through an individual with sighted control who has 20/20 vision, a person who is ocular blind with profound blindness, light perception, and an individual with CVI who has 20/20 vision. So the takeaway from here is that notice that the individual with ocular blindness, their brain looks essentially the same as someone with neurotypical development, but yet they have light perception, they're profoundly blind. And here's an individual with CVI where clearly there's been extensive damage. You can see in this dark area here, but yet this person has 20/20 vision. So how is this mismatch possible? And that's really what I'm trying to get at. We want to look at the data in a way that gives us more information about how the brain is wired. And the technique we do that is called whole brain network-based analysis. And it looks something like this. So here's the same brain or the same group of individuals. These are sighted controls. And the lines in between the blue dots tell us how strong the brain is connected. So red means very, very strongly connected. Blue means weakly connected. And you can get a sense here that in the case of sighted controls, the brain overall shows this very, very strong connectivity. In the case of ocular blindness, we see that this connectivity is also very, very strong. Again, lots of red lines telling us that overall the brain in the case of ocular blindness shows really, really high connectivity. And here it is in the case of CVI. lot less red, much more blue, telling us that overall the connectivity of the brain is weaker in the case of CVI than it is in the case of ocular blindness. And we think this is very, very important because what that tells us is that brain-based visual impairment is fundamentally different from ocular-based visual impairment from a brain wiring standpoint. And we need to take that into consideration. Second piece of data I want to share with you, as I mentioned, is using virtual reality as a way to assess visual performance. And I gave you this, this idea, for example, of looking at a toy in a toy box. So we created a virtual reality task based essentially on the same idea. The task here is that the child has to look for this blue truck that's going to be placed anywhere on the screen. And we changed the number of toys that are presented around there. This yellow blob that you see here is where the eyes are at any given time on the screen when they're searching for the blue truck. And we use an eye tracker to do that. The idea here is that we make the task progressively more difficult. We add different toys. We maybe add another toy of the same color but different shape. We may, for example, change the background to make the task much harder as well. And what I'm going to show you in this video here is a head-to-head comparison of a control individual and an individual with CVI as they try to search for the blue truck. And the first thing I want you to notice is that notice in the case of the control, they get straight to the blue truck, whereas the CVI individual takes a much more complicated and longer path to get there. Here's the color match. See how the CVI kid has to go back and forth and check? Here is this large background clutter situation. In this case, they actually found the blue truck, but in this particular example, you see they missed it entirely. Now, this is very, very important because this is something that you would not ever, pick up on a simple eye chart or a simple eye exam. And this also fits what we hear from blind children. They tell us that after a day in school, they're absolutely exhausted, for example. And this gives us some sort of indication that their eyes are working much harder in order to do very simple things like simply locate something on a screen. We do have more data about this. We've looked at CVI as a group compared to controls, as well as children with ocular-based visual impairment. And just to explain to you the data here, on this axis here, going from low, medium to high, the task is getting harder, right? So as you move to the right, the task is getting harder. On this axis here is their performance. And in this particular case, the higher you are on this axis, the worse that you're doing. So you want low numbers on this. So in our controls, I should say, shown in blue, you can see that the relationship that as the task gets a little bit harder, the performance is essentially flat, a slight uptick between medium and high, but overall the performance is pretty much flat, right? In the case of our ocular visually impaired individuals, we see that overall their performance is generally worse, but again, there's that same flat relationship as a function of task demand. And in the case of CVI, and the low task demand, they start off somewhere intermediate. And as the task gets harder, do you notice there is this now very steep relationship with task demand? That's to say that as the task gets harder, their performance actually worsens. And we think that this is a hallmark sign of CVI. In fact, under high task demand, they're operating as if they were an individual with ocular blindness, or ocular visual impairment, I should say. But at low task demands, they may be doing just fine, for example, just in a simple eye exam. So it's important to differentiate their visual performance in low task demands versus high task demands settings. So just some important takeaways from this work. So first of all, the connectivity or the wiring of the brain in CVI is fundamentally different compared to the case of ocular visual impairment. And we think this is really important because this should have an impact in terms of the rehabilitation of children, right? If their brains are fundamentally wired differently, the strategies we use for brain-based visual impairment versus ocular-based or eye-based visual impairment are probably going to be very, very different. The second thing to take away from this is that individuals with CVI are very sensitive to increasing visual demands. And we think this also is important because it has an impact on visual assessment, as well as the adaptive and compensatory strategies that we come up with. Again, the things that we're going to do for the case of brain-based visual impairment like CVI may not necessarily be as effective or comparable to the case of ocular-based visual impairment. So just to say thank you, I unfortunately don't have the time to go through all these individuals, but I want to highlight that this is a very, very large collaborative effort. People working at the lab as well as nationally and internationally with us. Also want to highlight our collaboration with the Perkins School for the Blind and support that we're getting from the National Eye Institute as well as private foundations. Thank you very much.
Thank you, Lafi. Our next expert panelist is Chris Russell, Project Coordinator for the New York Deafblind Collaborative and Adjunct Lecturer at Hunter College, as well as Board President of the New York AER. Chris, welcome, and thank you for being here with us today.
Thank you so much to Ed Basso, and thanks to everyone at Perkins for welcoming me to join today. It's an honor to be here. Thanks as well to Dr. Beth Brady from Hunter College for inviting me to represent Hunter in this capacity too. My short talk today is just a sort of call to action for educational professionals and anyone engaging with the educational field. First, I want to just give you a little bit of context and background for myself and how I got here. I first worked with students with CVI as a paraprofessional, then as a classroom teacher, and then as a TVI. My training had prepared me with definitely some strong competencies in CVI through Hunter College, where I attended graduate school in the programs for severe and multiple disabilities, as well as the TVI program. But I was by no means an expert. I learned most of what I understood at the time as a para, as a classroom teacher, and as a TVI through my students themselves. And I still feel that students are your absolute best teachers. However, in seeking out that additional expertise, I deliberately sought out professional development and coaching from experts and from skilled peers, specifically in the CVI range approach to assessment and intervention, which I recognize to be a comprehensive and child-centered approach towards working with students with cortical visual impairment and CVI. I wear several professional hats now, as Ed mentioned a few. You can see them there in my signature, including as an adjunct lecturer at Hunter College and as an assistant instructor for 2 Perkins e-learning courses in cortical visual impairment. And in my main role as project coordinator for the New York Deafblind Collaborative, I see hundreds of educators in various educational roles who are exactly where I was. They have some training, they have some expertise, and they have a dedication and a passion towards working with students with cortical visual impairment, but they need something more. They need ongoing training, professional development, and coaching. So in my focus, I think what we really need is educational professionals across disciplines, including related service providers, speech pathologists, occupational therapists, physical therapists, classroom teachers who have a strong skill set in CVI. And when we say strong skill set in CVI, we mean with regard to identification and referral, and especially early identification of students with CVI, appropriate assessment across domains, including functional vision assessment, child-centered quality intervention practices. We need collaborative teaming, and as Ed had mentioned in his intro, we need cross-sector collaboration, which I think is what's so special about this panel right now, that we can think from the perspective of making connections between education, the medical field, as well as parents and parent advocates. I want to introduce you to a term, scaling up, which I know that Rachel will speak a little bit about as well as it relates to the parent role. Scaling up refers to a practice from the field of implementation science, which deals with making systemic and sustainable changes across systems in an upward trajectory. So in the educational field, that means starting with the classroom, developing practices, identifying stakeholders, assessing their readiness, finding models that we know work, and scaling them up so that they not only affect the classroom, but they affect the entire school, the entire district, the region, the state, the entire nation, and hopefully as we go in the long term on an international level towards establishing educational practices appropriate for students with CVI. Educators are absolutely on the front line. CVI intervention is an educational approach. It's an educational intervention. We have expertise from medical field. We have expertise from various different fields that impact children with CVI. But the treatment for CVI is truly educational intervention. It is a systematic approach towards structuring and adapting a child's day with the goal to improve their ability to see and to understand their world. And think about this concept, that it is not just learning to see, it is seeing to learn. And so in that regard, intervention must truly be embedded across the student's day in a holistic and a comprehensive way. Also, intervention is individualized and must be absolutely geared towards the individual needs of the student, which is why assessment is so important. It is not a one-size-fits-all approach. There are lots of resources available on the internet and in various different programs and agencies There are a lot of examples of practices, especially of possible interventions or examples of adaptations. But if you don't know what you're looking for, this can actually lead to just further confusion. So we need to be able to look at these resources and practices in a way that's critical and with a holistic understanding of what CVI intervention is. Medical and clinical research is essential to expanding our understanding of CVI as well as our diagnostic practices. But there's a third critical branch of research, educational research. We have a strong foundation of educational research and practice in the field of CVI, but we have a great need for additional research to solidify and to expand upon promising practices, and in particular in the area of educational intervention. We're working toward effective systems. We have some examples of what works. We know that it's important to embed CVI content into personnel prep programs, and we've done a really excellent job, if I don't pat myself on the back too much, and Dr. Brady, at Hunter College for embedding this content across the entire programs for severe and multiple disabilities and blindness visual impairment, as opposed to just one isolated lecture or even an isolated class. We know that ongoing in-service professional development is critical to schools, and it must be across departments. It shouldn't just be to the teachers of the blind and visually impaired, or TVIs, as I've been saying. It must be to various related service providers and educators. We have what are called communities of practice, and we also have a great need for establishing further communities of practice. This refers to the development of peer learning communities, basically groups of like-minded individuals who are in a similar situation and come together around an area of need. In this case, educators. We have examples of mentor-based and coaching-based communities of practice, including in New York City at the New York Deaf Blind Collaborative in collaboration with the New York City Department of Education, as well as with Hunter College and other related agencies serving students with visual impairments. We've developed a cortical visual impairment cohort that's based around a train-the-trainer model, basically training up these professionals to be competent, and not just competent, but to be experts in cortical visual impairment. And then they can go out and do further training in their own communities, schools, and to their own peers. So it's an expansive model. We also have, through Perkins School for the Blind and Perkins eLearning, the Perkins Roman CVI range endorsement. This is a group, a list of, we now have 201 CVI range endorsed professionals. These are people who can reliably score the CVI range assessment across 35 states in 8 countries. And I would highly recommend looking at the list of range endorsed professionals to see who is range endorsed in your particular area and region. I want to wrap up with just a call to educators. Be diligent. Keep up with ongoing training and skill development, and also recognize that children are your best teachers. Don't be afraid to stop learning. Be collaborative and include parents. Recognize that parents are the drivers of change, especially of legislative change and of true practice change at a state and at a national level. Be curious. Don't be afraid to say, I don't know. How else will you learn? And ask yourself, whatever your role and your position is, how can you leverage existing resources in your own community to scale up effective practices in that upward trajectory, so that we're not just affecting individual students, individual classrooms, but we're moving up towards recognizing the need for establishing practices across larger systems. Thank you so much. I'm going to wrap up and turn it back over to Ed.
Thank you, Chris. It's now my pleasure to introduce our final expert panelist, Rachel Bennett, parent of a child with CVI, community manager for the Perkins CVInow.org website, and a fierce advocate for all families and children with CVI. Rachel, welcome.
Of course, I was muted. Thank you, Ed. Thank you all for making this event possible today. It's wonderful to be here. I am Rachel. I am the new CVI Content and Community Manager for CVInow.org here at Perkins School for the Blind. CVI Now is a go-to resource for inclusive, vetted, and current information on CVI. I'm also a CVI mom, and today I will share with you my own CVI journey, as well as the needs of CVI families. So Here is my son, Henry, in all of his glory. Henry is 8 years old. He loves all household appliances, the washer, dryer, the Instapot. He loves to walk to the local bakery, go swimming, FaceTime with his friends and family, and give big, long-lasting hugs. Henry has CVI and co-occurring ocular impairments, along with other needs. His neurodiversity is most likely due to a rarely known variant in the ASTN1 gene, which is responsible for sending neurons to their final position during fetal brain development. Since he was born, we puzzled over Henry's vision problems, coupled with developmental delays, feeding issues, and behavioral outbursts. By the time Henry was 1 year old, he was diagnosed with optic nerve atrophy, nystagmus, low acuity, exotropia, but it appeared that his unique visual behaviors were a mystery to his medical and educational providers. Why didn't he look at me? Why didn't he recognize me when I walked in the room? Why wasn't he interested in toys, videos, books? Why did he freak out in new and busy environments? We had so many questions and very few answers. We saw pediatric ophthalmologists, neuro-ophthalmologists, neurologists, a pediatric genetic ophthalmologist at the National Eye Institutes at NIH, and no one ever mentioned CVI. This included a series of teachers of the visually impaired that had worked with Henry since he was 1. So of course I took the wait and see approach. If these doctors and teachers aren't sure, then Henry's vision must be a mystery. He must be the unicorn. It wasn't until he was 5 years old that he got a medical diagnosis of CVI. I knew his vision wasn't typical, but I didn't know how significantly visually impaired my child was until after 5 years of being his mom. And this will always be with me. And many families don't learn about their child's CVI until their child is a teenager or older. At every level, the system failed Henry and robbed him of years of appropriate intervention and opportunity to improve his use of vision. We know the critical role vision plays in all areas of development: gross motor, fine motor, communication, learning, behavior, and social skills. I constantly ask myself, what if I figured out Henry's CVI when he was younger? What would be different now? In the image on the left, here I am with Henry at his 4th visit to the National Eye Institute at NIH. This time they heard all about CVI. We left the appointment with the lead doctor looking up cortical cerebral visual impairment on his research database. And now, thanks to a grassroots campaign within the CVI community, CVI is part of NEI's future strategic plan. In our CVI community, Henry's story is common. Children with CVI are underdiagnosed, misdiagnosed, and many have difficulty getting access to appropriate educational services. Children with CVI have a right to an early diagnosis. They have a right to effective vision services. They have a right to an appropriate educational program. As parents, we live with CVI 24/7. Henry lives in a world not designed for him. His frustration, anxiety, and behavior show his need for access every day. He misses so much by not being able to fully access the visual world. We all learn through incidental learning, what we observe from the time we wake up to the time we go to bed. And Henry misses this. Everything needs to be directly taught: how to use utensils, how to navigate a new environment, how to draw and write, how to recognize something unfamiliar, how to wave goodbye, how to get dressed, how to use the toilet, how to visually tend to a 2D picture, how to sort colors, how to jump. And the list goes on and on. Incidental learning teaches foundational concepts that are the building blocks for learning and independence. So yeah, raising a kid with CVI is the challenge of my lifetime. We recently moved to Boston, the Boston area, so Henry could have access to better medical and educational services. It has been the best decision I've made in a long time. His new pediatric ophthalmologist at Boston Children's Hospital knows CVI well. She registered Henry for the Massachusetts Commission for the Blind. Henry is legally blind. He now has access to services that he's never had before. We found a school system that sees Henry for his strengths and abilities and sees his CVI. He is included in the general education classroom with a great team of educators supporting him. His TVI is outstanding. For the first time in Henry's life, his TVI completed a comprehensive assessment. For the first time, I finally got a clear picture of the educational impact of Henry's complex visual impairments. His educational program is now individualized, intentional, and targeted, and he's making progress, but most importantly, He's happy. He's not having a meltdown every day because he has life-changing access. Every child with CVI has a right to appropriate medical and educational services, no matter where they live. CVI families shouldn't have to chase services. We need solutions. We need to respond to this public health crisis in a big way. We need more research at every level and every area. There's so much we need to figure out. We need medical and educational providers to know how to serve kids with CVI. We need systems change so no kid with CVI is ever left in the dark. But now more than ever, we're on a precipice of change. There's a movement in the right direction. There is more awareness of CVI. Parents are finding their collective voice. Medical and education providers are waking up to the #1 cause of pediatric visual impairment. And here with CVI.org, it's a big moment for CVI families. This is an exciting, dynamic, and responsive resource. So head on over to CVInow.org to learn more about CVI, and for parents to learn how you can get involved, share, and connect. Thank you so much.
Thank you so much to Rachel for such a wonderful presentation, and thank you to Latvi as well. At this time, we're going to open it up to a Q&A portion, and we are now opening up the chat box to all attendees. So if you have questions that you'd like to ask any of the three of us, please type them into the chat box. In the meantime, just to get started, I have a question to offer to Rachel. Do you have any tips for families with newly diagnosed children with CVI in terms of first points of contact and first steps?
Yes, that's a great question. Thank you, Chris. You know, it's such a hard diagnosis to process, so it's really important to take the time to process what this diagnosis means for your child. I mean, I really feel like CVI affects the whole being. And then it's really important to get comprehensive assessment. It is really critical. And so, because the really big problem for Henry was that he was never comprehensively assessed with his educational team. And therefore, nothing was intentional, nothing was targeted, and he was having a really hard time. And so you need CVI-specific tools, including the CVI range, Dutton's inventory, the Teach CVI screening tool, Matt Tejan's complexity framework and 2D image assessment. You need a learning media assessment with a CVI lens using the sensory balance approach. So there's a lot that can be used to assess our kids with CVI. And then from there, it really takes the collaboration among team members, like you were talking about, Chris, to fully serve the whole child. And so you need to really also think about, OT, PT, speech, and reevaluating your child through that CVI lens now as well. Connecting with other families is really important. We have a really robust CVI community, and that's really, really important just to figure out, how can I learn to work with my kid at home? How can I incorporate, adaptations and accommodations in the home to really help my kid, use their vision, to keep them active in their world, and to promote development and growth.
That's fantastic. Thank you, Rachel. Just as a little quick follow-up to that question, when you mentioned parents getting involved in parent community, are there specific sort of first places that parents should be looking? I know that there are Facebook groups, there's teleconference groups, and with CVI Now, you also have something going now as well.
Yeah. Even when my son was diagnosed just 3 years ago, there wasn't that much of an online presence for CVI, and now parents have a lot of resources to choose from. CVInow.org is one of them, and it's going to grow into a really robust, comprehensive resource. There's a CVI Now parent group on Facebook. We have live interactive virtual events with experts. There's also other CVI awareness groups on Facebook as well. And so if you're into that social media, that's a way to connect. There's also a weekly teleconference call for CVI families, run from the New York Lighthouse Field as well, to be able to get involved. And, there's lots of different parent blogs that you can read and find. Start Seeing CVI is one. Kaleidoscopes is a parent podcast about kids with CVI as another example. So parents, we're movers and shakers. We're out there.
Absolutely. That's great. And I think we can probably get some of those resources that you named into the chat box while we're going as well. This is a good one for Latvi. Latvi, where can we find more information on the research being done with eye gaze VR assessments and testing? And I think sort of a good general expansion to that is, where do we find accessible examples of the research that you're doing in general and that's being done?
So specifically in terms of the eye gaze study, as I mentioned, there's two big avenues of research that we're doing. One is indeed this assessment and eye gaze related work, and the second is the brain imaging. Certainly, our lab webpage is a good resource that kind of gives you some background of the work that we've done, and I'm happy to share that information. If you're on Facebook, we do have a page called the CVI Neuroplasticity Research Group. That's where we post a lot of our announcements, papers that we think, or studies that we think that are interesting, various announcements in terms of research that's being done in CVI in general. And last, I would say, feel free to reach out to me directly. And again, I'm happy to share that information, particularly if their families have specific questions or are interested in participating. I think those are all avenues. And to Rachel's point as well, certainly use the social media and internet platforms that are out there.
That's great. Thank you, Latvi.
Yeah.
I see one that's probably geared towards the educational approach, but this may be one as well, Rachel or even Latvi, that you might have additional input on. And it's about, what recommendations could I make to my school that is totally unfamiliar with CVI and sort of, I don't even know where to start. I'm sort of thinking of this as a question that I get quite often, which is a new student comes to the school or into the classroom even who has CVI, and there may not be any other student with CVI in the classroom or the school. There may be little, if any, information that anyone on the team has received about CVI. So I think this is probably a good question for all three of us. I think I would just start off by saying that I see this exact question very often. I hear it very often. And my usual go-to is that everyone on the team needs to, first of all, get together, because collaborative teaming is absolutely critical for students with CVI. So the aim of supporting the team should not be made toward one individual person on the team. It should be made toward the entire team as a whole. So the first thing is to get everyone together as a collaborative team, which should even include the administration if possible, and should absolutely include any paraprofessionals and aides in the classroom. And everyone needs a CVI 101 training. That can look a little bit different depending on the situation and the local resources. But in my role with the New York Deafblind Collaborative, I do a lot of CVI 101 training for students who have cortical visual impairment and additional hearing loss. And I also do that kind of training out towards districts who may identify kids with both cortical visual impairment and additional hearing loss. But I see it as a major need to even have, a beginning 1 hour 101 training, understanding CVI, understanding what it looks like, understanding the phases of severity of CVI, and recognizing that each individual student is going to require a totally individualized intervention program. So anything you guys want to add to that one?
Rachel, go ahead.
No, I love that, Chris. I love that you're talking about collaborative teaming and the whole child approach. And often parents, we are the ones who teach providers about CVI. And just know that even if you don't know CVI well, you are the one who has collected the most observational data of your child. And so what you observe and what you see all the time with your child is really worthwhile to share and to talk about.
Yeah, Chris, if I may, the only thing I would add to that, to the collaborative idea, very often parents tell me is, I can't find a doctor, who A, believes in this or is familiar with CVI. And my answer to that is, if that's the case, find one who does. I really think it's about establishing allies. And certainly if there's somebody on the medical side who can advocate for your child and, for their needs, that often is very, very much the first kind of helpful push that's needed to get the rest of the dominoes that are falling. So I would certainly recommend finding an eye care provider, optometrist, ophthalmologist, pediatrician, pediatric neurologist who's familiar with CVI and is willing to work with you and act as an advocate.
Thank you. I'm so glad that you added that, Latvi. It also, sort of to piggyback on that, another question that I think relates to exactly what you just said is about that cross-sector collaboration, especially between educators and the medical field. the parents are the connecting piece that, that are in touch with both fields and sort of playing the in-between often unfairly. But how do you see cross-sector collaboration between the medical and educational field, and what can we learn from each other, but also how should we even be communicating with each other around student plans?
Yeah, Chris, I think that's an excellent point, and I really think it is going to be the most crucial factor in terms of moving the field forward in the future. I think we're all familiar. There were a lot of pioneers who started off this field, whether the medical, the education, the rehab world, and so on, who did really groundbreaking work at the time. But I would argue, but we're kind of sort of like in their own silo or in their own world initially, because they were just trying to figure out what was happening. I think we're at the next generation now where we can start pulling all those ideas together and looking at this from different perspectives. It's not just a medical problem or an educational problem or an advocacy problem or anything. It's all of these things. So I really think moving forward, the model will be comprehensive, multidisciplinary, collaborative research, where each piece is informing one another in terms of how to move forward. So for example, on my side, I'm in medical research. I try to have extensive conversations with teachers and parents of kids with CVI, because I want to know, what are the things are you thinking about? What are the things that we should be taking back to the lab and informing the way that we design our research platform? So this cannot be done in isolation. I think moving forward, we have to have this collaboration. And I stress upon this because we've seen the same sort of evolution in things like cerebral palsy, autism, and so on. People were kind of working in their own areas, trying to figure things out. And the next big leap happened when specialties came together.
Mm-hmm. I love that. Also, a lot of times the ophthalmologists, the optometrists are the gatekeepers for our kids, and they're the ones who reserve our kids to state services and local services. And so when there's that bridge between the medical and educational community, it opens up a whole new way and path forward for our kids.
I couldn't agree more with both of you on that. These are sort of also some nice piggyback questions. Just logistically, who is the medical professional, or who are the medical professionals that do diagnose CVI, or that you're finding typically diagnose CVI? Is it a neurologist, a pediatric ophthalmologist, a pediatrician, an optometrist, a neuro-opt? And what does that process look like for diagnosis at this point?
Do you want to jump in on this one?
Sure.
Yes.
Yeah, I mean, unfortunately, there is no hard and fast rule about this. The reality is it's any healthcare provider who has the familiarity, first of all, with CVI. That may be an optometrist, it might be an ophthalmologist, it may also be, a pediatric neurologist, et cetera, et cetera. It has to be someone who can kind of assess what's going on, understand the history, understand the presentation is not a typical presentation that we would see, for example, with an eye-based visual impairment. And I really believe that is the first domino that follows. Here in Boston, we're very fortunate that we have really great expertise. Rachel, I'm going to give a shout out to Dr. Jenna Hadari, that I know that you work with. I mean, she is a neuro-pediatric ophthalmologist. I mean, all three specialties in one. And, unfortunately, there are not many like her. And, we're fortunate, to have people. Dr. Barry Cran, who works at the New England Eye Clinic at Perkins, has extensive experience working with CVI and developmental conditions in general. Who's an optometrist himself. So I guess my take-home point here is that I don't think it matters so much what the specialty is or what the letters are after the name. It really is an individual who is familiar with CVI and, like I said, willing to be an advocate and understands that this isn't just a 15-minute visit, that this is the start of a lifelong journey and they're going to be part of it.
That's fantastic. One of the sort of catchphrases that I have in doing training around CVI and especially around diagnosis is a frequently asked question that I get, which is, what do you do when you see unable to test on a medical exam? And I think I'm seeing some facial expressions from both of you. My go-to recommendation for that is that reminding people that there's no such thing as unable to test.
Yes.
Unable to test is just a doctor saying, I'm not a specialist in this area and go find one who is. So, I mean, I think that's a really important point for families, but it's also a critical point for professionals who are getting medical records. And just like families, educational professionals have white coat syndrome too, and they look at those medical reports and they think this is the word of the expert. But it's important to go and find the person who's the real expert in this actual condition.
I agree. Unable to test does not exist. Unable to test means I can't test. That means you're going to have to find someone who can.
As Dr. Barracran said, no patient is untestable.
Absolutely.
I've had that written on Henry's report several times. So no more though.
Good.
Rachel, I had a really great question that I think all of us could probably provide a little bit of input on as well. Do you have suggestions for how a parent can know if their TVI, their teacher of the blind visually impaired, actually knows about CVI? And what do you do when you go to, and I think this applies across roles, what do you do when you have someone who doesn't appear to be taking child-centered interventions that are, have fidelity and have knowledge and competence behind them?
It's a really big question. It shouldn't be this hard to find providers to really work with our kids across the country, but it is, unfortunately. I had experience with it in the past. And, how do you find, you need to know that the TVI knows how to assess your kid. And so they don't know the CVI specific tools. That's a big indicator. If they are using, the traditional ocular-based assessments or ocular-based approaches that they, are used to with kids who have ocular impairments, then that's something that you can ask questions about. But you should always ask questions. If a TVI is wanting to do a certain assessment or putting a certain strategy or approach in place, ask why. What data is it based on? How is it going to support my child's functional vision use? And, I definitely was the parent who came in with a big PowerPoint presentation to talk about CVI. Sometimes we're the ones who teach the team about CVI if they're willing to listen and collaborate.
Yeah, thank you. I would only add to that from the educator perspective. I did outline this a little bit in my sort of final call to you. Is don't be afraid to say, I don't know. And especially as a teacher of blind visually impaired, a TVI, it's okay for you to say, I don't actually have expertise in this area. And that doesn't make you an ineffective or a bad TVI or educator. It means that you're accepting that you need more support to be able to provide appropriate educational services to this student. And you should be able to get those supports and those resources. They certainly exist. They may exist locally. If they don't, they definitely exist through professional development, including through Perkins e-learning. The information is out there. We certainly need more, and we need more research, as I said, but don't be afraid to say, I don't know, I actually need support with this, regardless of what your role is. I think that often our sort of school systems pit parents against educators and vice versa. And that's a barrier that we need to work towards breaking down. Yeah. It should be about partnership, and that can only happen when you can lay it on the table and say, I really don't know. I think we are sort of at the end of our time for questions. So did either of you want to add anything else toward the end before we turn it back over to Ed?
If it's all right, I just happened to see one question that scrolled that I thought was important because I think it's on me to help clarify. The question was whether or not glasses are helpful and should children wear glasses and so on. And I think maybe I either misspoke or perhaps it was taken out of context. When I say that glasses don't help with these visual problems, what I'm saying is that glasses per se will not correct these higher order processing problems. But that's not to say that glasses are not useful. I'm running under the presumption that every child gets a full comprehensive eye exam, corrects any eye refractive error that's out there. So in other words, by the time they're out in the real world, they're operating with the maximum ideal prescription that they have. And then after that, we'll start talking about those perceptual issues. So I just wanted to clarify that because I thought that was a very, very important question.
And as you know, as an anecdote, Well, a lot of kids with CVI also have co-occurring ocular conditions. With
Absolutely.
Henry, his glasses are for his myopia. And so, but that doesn't help his, visual processing capacity. It helps him see whatever he's seeing just a little more clearly so it can support his visual attention and recognition.
That's right. That's right.
I'm glad that you clarified that, and just, that glasses, lens prescriptions are for acuity purposes primarily and will not have an impact on visual processing on a whole from a neurological perspective.
Right.
I'm glad we had the time to clarify that. I know that there are other questions that we didn't get to fully answer, and we do appreciate your asking them. We encourage you to please reach out to us and send those questions if you want some further clarification, or if there are additional resources that we mentioned or that you're looking for that you'd like to share. At this point, I'm going to turn it back over to Ed, and just wanted to say again, such a pleasure to get to speak with both of you. And I hope everyone in the audience enjoyed. Thanks so much, Ed.
Thank you so much.
Thank you, Chris.
It's a pleasure.
I want to thank the panelists. Wow, if we could all be in the room together, we'd hear some really loud applause, I think, at this point for the gift of their expertise, their time, and just appreciate your generosity sharing with us today. Thank you again to the audience participants who sent some phenomenal questions in. I know we couldn't get to them all, as Chris said, and we're sorry we didn't, but doesn't mean they're not important. Keep asking those questions. They're so critical for us. I want to thank you again for joining us today. My sincere thanks to the Perkins team, as well as to Dr. Beth Brady and Chris Russell from Hunter for the commitment and work to bring this session to all of you. This was not just an invite, just so you know, this was not just an invite to watch and learn, but more importantly, it's an invitation for you to join us in making sure that every child with CVI gets what they need. We're making progress, sure, you've heard about progress, but there's so much more that we still need to do. We invite you to find your way of plugging in, whether you decide to help us communicate, advocate, educate, or donate. We'll take it all. Stay engaged, please. Help us to change the way we see children with CVI and the way children with CVI see the world. Thank you for being with us today. We so appreciate your participation and look forward to seeing you all again soon. Thanks so much.
Text on screen. Perkins School for the Blind and Hunter the School of Education, thank you for joining the movement to tackle CVI. Please sign up for more information at cvinow.org.